Hello, it's Dr. Rachel Brown. I'm here for this month's Prisma Health Business Health Solutions COVID and Wellness Update. Great news. Numbers of COVID infections are way down, and most people are feeling very happy that it looks like we've gotten past the Omicron surge. No one wants to say anything out loud about if there's anything else coming down the pike, but so far things are quiet. So I'm going to start right off the bat sharing some information with you. We're going to talk today about how some of the vaccine recommendations have changed, but most importantly, what we're seeing in terms of mask guidance. So let's start here at the DHEC page that looks at South Carolina and the number of cases and hospitalizations, et cetera. You can see we just went through this tremendous Omicron surge. Look at the numbers compared to the Delta surge and our first surge. They're way back down. So this is wonderful. Most importantly, look at this, the number of cases in our state. We only have one county, the Sumter County, that has greater than 200 cases per 1,000 folks, and they're at 233, so hopefully they'll start to drop as well. So some of you are probably excited to hear that mask guidance is changing. When you go to the CDC website, you can find a page that describes what it is that they are proposing for mask guidance. You can even check by county where you fall, but let's talk first of all about the new guidance. So when there is a county that has a low community level of COVID-19, there's no mask recommendation for folks. So whether you're indoors, outdoors, vaccinated or not, you don't have to wear a mask if you don't want to. They're starting to look at number of cases in an area, of course, but also rates of hospitalization and hospital capacity, as well as some vaccination information and types of coronavirus that are in the area to help determine this community level. So if your county is low, no mask requirements. If the community level is medium, they recommend that folks who are at risk for complications or severe consequences from COVID, so those folks who maybe are tobacco users or who have chronic disease, who are overweight, pregnant, those kinds of things, those are the immunocompromised. Those are the folks they would recommend please continue to still wear a mask, because if you get COVID, then you are at higher risk for disease, but everyone else can feel comfortable not masking. And then finally, if you're in a county that's high, the mask recommendations still stand. So folks who are indoors, in public spaces, regardless of vaccination status, need to be wearing masks. So let's just play with this county checker quickly. I've already put in South Carolina here. I'm going to do Richland County, which is where I'm located today. Let's go down a little farther and see what it says. Yesterday we were high, today we are still high. So in Richland County, we're still wearing masks. However, look what happens if we go to, say, for instance, Greenville County, where a lot of you may be located. You all are in the medium community level range. So this means that folks can feel comfortable unmasking if they're not at risk for severe illness. Now, keep in mind two things. One, obviously, an organization has the right to determine what their masking regulations are for themselves. So if you walk into a local Starbucks and they want you to wear a mask, then you need to wear a mask. And of course, if we relax the masking requirements in any given area or in an organization, anyone who still feels like they want to mask has that right to mask. So you, as a business leader, can start to look here to find out where your community level is and what sorts of changes you may make at your work site around masking. So this is exciting stuff. And overall, what this means is we are in a good place in terms of COVID numbers and COVID infections. You may even have heard some states around the nation deciding to go into endemic mode as opposed to pandemic mode with COVID-19. So fingers crossed it stays this way. All right, let's talk about some of the vaccine guidance, because a little of this has changed and you may have folks coming to you asking you questions about vaccinations. The CDC has put out a new vaccination schedule. You can find this on their website. They have a slide deck. And here we have folks who are not immunocompromised, their vaccine schedule. And I just want to point out a couple of differences. That second dose of Pfizer for 12 years and older or Moderna can be given anywhere from 3 to 8 weeks now after the first dose. Remember, it was 3 weeks when this whole thing started. But they're finding that by increasing the interval between dose 1 and 2, they're noting a much lower case of myocarditis, lower rate, excuse me, of myocarditis in some folks. Now that rate is already incredibly low, and those cases are curable and treatable, and there have been no deaths. But it's nice to know that you can drop that rate even lower by spreading out the interval between dose 1 and 2. And they also are determining that it may even give us better vaccine efficacy, which is pretty incredible considering against the original COVID virus strain, there was a 95% efficacy. Of course, we've seen that drop against some of the mutations. So getting that efficacy back up by spreading out the intervals is a really good thing. There's also a change here. You can get your booster, which is different from a third dose. That's for immunocompromised folks. Your booster at 5 months instead of 6 months after your 2 doses. Janssen's booster dose remains at 2 months after the first dose. Now, I want you to take a quick look at the vaccination schedule for folks who are immunocompromised, moderately or severely. Use a clinician to help you determine who those folks are. Remember, they get an extra dose, so they get this third dose. This is for 12 and older. We do have kiddos now getting the vaccine, which is great. They get a third dose, 12 and older. That's 4 weeks after that second dose. And then they can get their booster 3 months after that third dose. So this is a little bit different for folks who are immunocompromised, and this gives them much better immunity by having 3 doses adequately spaced apart and then a booster a little bit sooner than the rest of us would get a booster. So keep in mind those vaccine changes. It's important to know that both the Pfizer and Moderna vaccines are completely FDA approved right now for their first and second doses. Their third doses for immunocompromised and booster doses are still emergency use authorization, but we should expect a full FDA approval very, very soon with that. All right, believe it or not, that's all I have for COVID discussion today. And by the way, it is March 3rd. So again, if something happens after today, keep that in mind. I want to talk to you a little bit about stress in your workforce because we have been through an incredibly difficult 2 years, and that has included the pandemic and everything else happening in our world that's causing stress for you and for your employees. But what we're seeing is that folks aren't just getting burnt out, which can be sort of the end point of stress, chronic stress. We're seeing some folks, of course, become depressed, become anxious, and we have some folks who are even grieving for the loss of what may have been before. That is a significant number of significant number of people that you're going to want to find out about and get them to engage with any employee assistance program you have. However, there is a larger proportion of your workforce that may be going through something called languishing. So I'm going to share with you a TED Talk that I'm not going to play, but you'll have the resource here. This is Adam Grant, and he's an author who has pulled from some philosophers and philosophy research to discuss the concept of languishing in this 15-minute TED Talk. If you prefer an article to read, this was published in the New York Times back in April and then revamped in December. And it goes through, of course, this feeling of languishing. And what's key about languishing with your workforce or maybe with yourself is that these folks are not depressed. They're not feeling hopeless. They're not burnout. They still have energy. They just sort of feel joyless and aimless, that blah or meh feeling that folks have right now. There is an antidote to this that you and your other leaders in your organization can focus on to help folks kind of get out of that blah feeling. What's important to know about languishing is that there are lots of negative feelings associated with it, and it can impact your mental health. Okay, so even though someone may not be fully depressed, fully burnt out, languishing does have an impact on mental health. And you can see here in the latest data, really over half of us are feeling languishing. So what are some, now this is, fairly new. There's not been a lot of research around this yet, but what are some of the antidotes? What are some of the things you can do to help with that languishing feeling? Well, I've taken the concepts and condensed them into this algorithm NICE for you. And really it's about shaking it up, right? Because we just sort of got into this rut after the last 2 years. So anything new, that could be new spaces, new colors, new procedures, new ways to meet. Maybe you have walking meetings. Maybe you spruce up the cafeteria. Anything new, and the research shows that even the smallest of changes can make a difference. The next thing is really taking some time and getting your other leaders, supervisors, and managers to take the time to find out what their employees' interests and passions are. Sometimes those will not relate to work, sometimes they will be easily relatable to work. But if you can tap into what really gets somebody jazzed and help them to experience that at work, maybe they love teaching, maybe they would be good in an education role, even if it's for a small portion, just a few hours a week of their work time, that makes a huge difference to move them from languishing to thriving and to improve their mental health. Creativity is also a big part of combating languishing. Now, we generally think of creativity, say, in our hobbies, but you can use this in the workplace as well. Have folks with special skills, special knowledge, special passions and interests help you to creatively solve problems. Get them engaged in that way, and using that part of their brain will again shift them out of that languishing state. And then finally, just fun. Any kind of celebrations, music, decorations, rewards and recognition, any small moments of levity, humor that you can use throughout your workplace will make all the difference in the world. And again, get folks to move from languishing to thriving. So the last thing I want to show you is how to reach out to us. If you have any questions about masking requirements or guidelines for your workplace, if you want to know how to have a vaccine clinic, a COVID vaccine clinic for folks who may need their primary series or their booster. If you're curious about contact tracing still and quarantine rules, which have changed so many times, even if you only have a couple of folks here and there who are becoming infected, reach out to us. We can talk you through home tests and other types of testing too that you might be engaged in. And of course, we're always here to talk to you about how to keep your workforce healthy, happy, and productive, whether that's their emotional health, their physical health, and beyond. Next month, you're going to have the treat of talking or of hearing from our occupational health folks. Dr. Sandy Hardy will be talking to you, and we're going to alternate months now so that we can talk with you all about the different services we offer here and give you some advice on how to manage your workforce. So if you have any questions for us, come to our Creating a Safer and Healthier webpage. Scroll down here. You can watch my videos. You can use this number to call. Please know that we are always here to help, and that we are here to help you so you can help your workforce. And we'll see you next month.